Order. Priti Patel to move the motion.
To move that the House has considered the health and wellbeing in the East of England. Thank you, Mr. Chair. It's a pleasure to serve under your chairmanship this morning, Mr. Hollybone. And I'm particularly grateful to have secured this important debate and to take this opportunity and to be joined by my colleagues from the East of England across all parties to highlight and discuss the range of issues relating to the health and wellbeing in the East of England. Mr. Hollybone, these issues are substantive and there are many issues, and in particular I'd also like to welcome the Minister, the Honourable Member for Faversham and Mid-Kent, to this debate, because she will also be quite familiar with some of these issues, no doubt from the deluge of correspondence that she's been receiving and some of the recent debates that have taken place here in this chamber. And of course, Mr. Hollybone, this debate follows the excellent debate secured by my honourable friend, the member for Waveney, on the progress towards the government's levelling up missions in the East of England, which took place on the 31st of January, just 2 months ago. I know that he cannot be here to join us in this debate, but I do want to thank him for championing the levelling up agenda in the East of England and other colleagues that have also, particularly with the APPG, that have supported this. And during my remarks today, Mr. Hollybone, I'm going to speak specifically about some of these regional issues, as well as raising very specifically the health and wellbeing issues that are relevant to Essex and also to the Witham constituency. The Minister, of course, will be very familiar with the levelling up of the East of England report and the commentary it gives on health and wellbeing matters. The report highlights that while there are many areas in the region which excel, there are significant geographical places and communities where deprivation is affecting the outcome and opportunities, and some issues that require focus to be addressed. So with the 2021 census data showing the East of England to be the fastest growing region in terms of population, growing by 8.7%, rising by just under 500,000 to 6.3 million people, it will come as no great surprise to right honourable and honourable members that our region, quite frankly, is pressed. It is facing challenges when it comes to the health and wellbeing pressures associated with the growing and also ageing population. The ONS projects that by 2041, the number of people in the region aged over 65 will increase by almost more than 450,000. One measure in particular that the report highlights is the data around health life expectancy, where both men and women are spending over 1/5 of their lives in less than good health. In 2018-2020, the average health life expectancy for the region for men was 64.6 years compared to the average life expectancy of 80.2 years. For women, healthy life expectancy was on average 65 years out of an average of 83.3 years. So the challenge speaks for itself, it really does. And, you know, some of these figures are gradually improving, but of course this is an area of very, very significant concern across the region. And the scale of our region, the beauty of our region, also masquerades a number of health inequalities. Yes, I will give way.
I'd like to thank my right honourable friend for leading this debate and giving way. One of the challenges we've always had in my part of Essex, going back through many, many decades, is the difficulty of recruiting doctors, partly because no doctors were ever trained in Essex. So it was fantastic news 5 years ago that thanks to the Conservative government's policy and support, a new medical school opened in Chelmsford, training doctors in Essex for the very first time. Now, those first doctors will graduate in just a few weeks' time. And I'm delighted to tell her that the dropout rate on that course is only 3%. On average, it's 8% across the country. And that many of those new doctors want to stay working locally in our area, which is fantastic. So will she support me, and indeed will the Minister support me, in supporting Anglia Ruskin University's campaign to double the size of the medical school in Chelmsford?
Well, my right honourable friend is absolutely correct. And I remember, in fact, the opportunity to support the business case for the medical school, which now was something like 7 years ago, in fact. And I actually want to pay tribute to everyone that was involved in that. It's an amazing medical school. I think in Essex in particular and in the East region, we're very proud to have the Anglo-Ruskin Medical School. I mean, I've seen the campus, the size, the scale, the facility, but actually the enthusiasm of the students that are coming there. And I think she's raised an incredibly important point, which is, you know, we have to grow our own in Essex, but also in the East region. And through a lot of the work, and if I may, Mr. Hollingbow, I will come on to this when I speak particularly about primary care, we need those students to be placed locally within GP practices to really grow the footprint locally. We really do. But also, the point about the medical school and the challenges around life expectancy and the delivery of good health outcomes speaks to the very issues that we face in the region. And they include, for example, heart disease, lung disease, diabetes, lung cancer, stroke, depressive disorders, falls and drug-related deaths. Now, as our population grows, of course, on top of the age profile changes that we are experiencing and will continue to experience, we will need more qualified general practitioners, but also medical specialists to be able to service those individuals and, quite frankly, be able to support the community. So it's not only the demographics, it's also the scale of the health challenges that we face. As well, if I may say so to the Minister, the geography. East of England is a very, very diverse part of the country, and also rurality and the coastal nature of it really puts pressure when it comes to services. Of course, I will give way.
I thank my right honourable friend for giving way, Mr. Hollingbow. But would she agree that since we've been devolving powers and money to local ICSs, and centralised NHS England is deeply inefficient in many ways. And I'm thinking about Clacton, that we have private dentists up and ready to serve with the NHS, but they're unable to. And I know the ICBs are going to absorb new commissioning powers, but without flexibility over NHS England rules, won't we just be shuffling a deck of cards?
Well, my honourable friend is the voice of common sense. He really is on this. He will recall from the debate that we held here, I think on the 31st of January, where we covered some of these issues as well. I actually spoke about the state being very inflexible and the state centralising too much of the resources that need to be cascaded downwards to meet patient care. My views on the size of the state are very well known, but I think yet again the centralised approach is wrong. It is simply not delivering the patient outcomes and the care that we need. We need the flexibilities. ICBs are brand new. They themselves are finding their own feet right now, as we know. I think we, as members of Parliament, have to support them so that they can establish themselves and they can work with their members of Parliament to understand the needs of our own constituents and the communities as well. But there is nothing worse, if I may say so, Mr. Hollowbone, than central government just literally funneling cash to another centralised organisation and bureaucracy within a region, and that money literally going on, for example, NHS managers, bureaucracy, and not on the healthcare that is actually needed. I will give way.
I'm grateful. I'd pick up the point about NHS dentistry, which I'm told is now about to be transferred in terms of commissioning into the ICBs. I think probably we all have had pretty grim experiences of access to NHS dentistry across our constituencies. Would the Right Honourable Lady agree with me that it might have been a good idea to actually hand this power back locally quite a long time ago?
Well, if I may, I thank my honourable friend for his intervention. I think he's right, and I do believe, and I think I've spoken over the years actually, around local healthcare provision. Practitioners know best. It is not for central structures to dictate basically the type of needs of a local community. And with that, of course, is access. It's access to services that matters so much. Dentistry, I'm afraid, has been too controversial for too long. And as a result, we see children now not accessing dentistry in the way in which they should do. And the health outcomes are absolutely shocking and appalling, particularly in young children. So I will give way.
I'm grateful to my right honourable friend for giving way, and I congratulate her on securing this debate. Recently, I had a meeting with Dr. Nick Stolz, who for 20 years ran the local dentistry committee in Norfolk and Suffolk, and who is now the professional lead for dentistry and wellbeing for the Integrated Care Board. And he described to me work done by the British Dental Association, which points out that in Norfolk particularly, it's almost a dental desert with no dentists able to take contracts, in some cases because of the inflexibility of the NHS England. Will she agree with me that reform is needed? And will she invite the Minister to agree that, as the British Dental Association said, fundamental reform of the NHS dental contract is urgently required to truly address the challenges being experienced by patients, dentists and the wider NHS?
Well, if I may, I thank my honourable friend for his intervention and actually for pressing this point. The British Dental Association have been pressing for reform for probably as long as I've been a Member of Parliament, if I may say so, Mr Hollowbone, and I'm very familiar with the case that they've made. And he speaks very clearly about the issue of access and inflexibility. If there's no flexibility in the system, then clearly the opportunity to provide services to meet local needs actually in an accessible way where people don't think that they're going to be charged or subject to some kind of, barriers to access, I think is absolutely important. So, yes, I will give way.
Mr Chairman, can I commend the Honourable Lady for Witham, a very effective minister, and it's good to see the Honourable Lady, the Right Honourable Lady, just as active in the backbench as well, and well done on this subject. This subject, of course, is one that doesn't affect me personally, but I want to just ask the Honourable Lady this question, because I believe, Mr Chairman, that the issue for the Honourable Lady and for me is the same. Access, the Honourable Lady, to services, access to GPs, to face-to-face GP appointments in particular, where a GP accesses or assesses what they see as well as the words they say are vital. And does the Honourable Lady believe, when it comes to those face-to-face appointments that all my constituents wish to have but seem for some reason to be restricted, does the Honourable Lady experience the same problems?
Yes.
And what would the Honourable Lady suggest that should be done to solve that problem?
Well, I thank my honourable friend for his comments, his intervention, and the points that he's made. I have in my remarks a whole section about GP access, particularly in the Witham constituency, which has been a very contentious point for my entire time as a Member of Parliament here. But he's absolutely right, and I have no doubt that his constituents obviously across the east of England, but also across the country, are facing the same challenges. And I think there are a range of reasons for that, which I will touch on in my remarks. But I think one of the key points that the Minister, I think, will be interested to know is that just in the east of England alone, and this does speak to facilities and access to care, that the per capita spend on health in the east of England is at £2,889, which is the lowest of any region and below the national average of £3,236. And like so much of the rest of the country, we face challenges. We're an ageing part of the country. Our region is getting older. So we face challenges which I think are now becoming quite disproportionate around health and social care and the workforce demands and need there. So the east of England has, for example, the smallest number of nurses per 1,000 population of any region across the country. And I would really like to urge ministers to not just review the flexibility of dentistry and contracts, but also to review the metrics. And again, this comes to the Levelling Up report, review the metrics of the east of England on healthy life expectancy and to look at providing more certainty to the region to help address the disparities, because these disparities affect, obviously, our constituents across the board. And I'd also like to raise with the Minister and ask her to look at what can be done to reduce the ill health and early deaths, particularly in respect to preventable factors. And prevention, quite rightly, Mr Hollowbone, is a huge and significant feature of the NHS, and it always must be. But again, we have serious considerations and factors in the east of England that I also know health providers and local authorities across the region would be really keen to engage with the government on this. And importantly, I'm going to volunteer them all because they do offer themselves up constantly for new pilots and new initiatives in this space. We are very, very proactive. And I do just want to pay tribute, actually, to Essex County Council. They've done a great deal of work in this particular area, and other key providers that obviously have the ability and the capacity and capability to provide services. So as well as supporting the region's Levelling Up ambition on healthy life expectancy, we're very keen to see improvements on well-being. And with that, of course, social prescribing comes into the mix as well. And we have to, if I may say to the Minister, and to all our colleagues here today and across the region, I think it's incumbent upon us to start to narrow that gap between top performing areas and really start closing that gap so that we can now see some equity across these big challenges that we see. It's a difficult health indicator and target to measure it, as the Levelling Up report has demonstrated. But, you know, we have the opportunity now to be innovative and work with new providers as well as our county council to drive the right kind of local outcomes in the way in which actually my honourable friend for Clacton has spoken about. Make it less bureaucratic and bring flexibility so that we can drive outcomes with our partners. I will give way.
I'd like to thank my right honourable friend for giving way again. Just on the issue of levelling up, I just want to make it clear that in my part of Essex, there is already great work doing on levelling up. So, for example, it's never been possible, due to lack of lower levels of funding, for people to get IVF treatment in mid-Essex before. But that has now been levelled up. And from the 1st of April, women will be able to get IVF treatment on the NHS in mid-Essex, which is really, really important to so many women and wanting to start their family.
Thank you. I thank my right honourable friend for her comments and intervention. I'm going to be very specific now about some Whittam issues, and I think it's fair to say the Minister and the entire department will be familiar with my bundles of correspondence on the Whittam Health Centre. One of the most important ways that health and wellbeing in Essex, in Whittam, and obviously the East of England can be improved is by strengthening services that are accessible. We've touched on this already, but delivered within the local community. And that applies to the provision of health services in Whittam. I never tire of raising the needs of my constituents across Whittam, but in particular Whittam Town. It's growing as a constituency and as a community, and we're very proud of that. We have some amazing outcomes in terms of education, for example, our rail services, all the infrastructure issues that we have been pursuing, but there is more to do. We've seen hundreds of new homes being granted planning consent, and actually thousands of homes being built with more residents coming to my constituency. We're a fantastic part of Essex. I do believe that the only way is Essex. But importantly, we now have a blend of new families and also families who have lived in Whittam for many, many generations. And like many towns, with a growing population of elderly residents and young people as well, we are a commuter town, but elderly residents living in care homes and homes around the town, and with young families and that blend and the population increase, we need our health centre, a new health centre. Since the start of the pandemic 3 years ago, the 4 GP surgeries in the town have seen their patient lists increase by nearly 3% to almost 32,000. But between these 4 surgeries, there are just 13 full-time equivalent GPs. Given an average patient GP ratio across the town of about 2,440 patients to every GP, this is about 50% greater than the national average. And between those 4, the range is 2,045 patients per GP and 3,150, each surgery well above the national average. And with so many patients, many of my constituents regularly report, and in fact throughout my entire time as a Member of Parliament for the Whittam constituency, too many patients are not getting appointments, far too many are unable to take action when it comes to dealing with their own health concerns, cancer risks being picked up too late, and in light of the issues and the health disparities that I've raised already, serious conditions and debilitating health conditions will not be serviced and attended to in a timely manner. It is no great surprise to the Minister and I think everyone in the department as well. I apologise to no one about the vigorous way in which I keep on raising the need for a health centre. This is one of the key projects that I have campaigned for my time as a Member of Parliament. We have to have the money coming directly to Whittam Town. With 4 GP surgeries and over 30,000 patients, there is a clear and compelling business case. I myself have even offered to write the business case for the GPs. I have done everything to facilitate the GPs coming together, which has been rather challenging because of the business models that the Minister will be well aware of, that exist where GPs do not always want to reach agreement and work together. That has been a major underlying problem, I'm sorry to report. But having a new facility, and this is the key point, having a new facility would mean more specialist treatments and services that can be delivered locally. And actually, it will give local constituents the greatest assurance, whether they've got young children or whether they are elderly, their needs will be taken care of within the town itself. There'll be medical practitioners, and there'll be therapists, there'll be nurses, there'll be others that could absolutely ensure that care is there for them. Along with, for example, bringing in new providers and doing much more on social prescribing. And I'm a great advocate of that. And I think we have to have this blended approach now when it comes to access to primary care. I will, of course, give way.
I thank my right honourable friend for giving way. And on that very point, I'd just like to bring up Clacton here. We have a new community diagnostic centre, which is absolutely brilliant, and thank you for that. But there was supposed to be a primary care hub too. And I had a meeting just recently with one of our local GPs. And this isn't forthcoming at the moment. And it is vital because hospitals like Clacton's Hospital are very important because they take pressure off the bigger hospitals at Ipswich and Colchester locally.
Yes,
so it is very important that we have this primary care hub, and I ask the Minister to respond to that. Thank you.
Well, I thank my honourable friend for his comments about his beautiful constituency and the needs on healthcare. But I do really want to press the Minister. For too long, my constituents and the residents of Whittam have been waiting for a medical facility, a new health hub, as we have dubbed it. And I'm afraid there's been inertia amongst the way in which people can come together locally to convene to actually drive this outcome. I do want to give credit to the new ICB and to one of our colleagues in the NHS who is heading up the ICB, Dan Doherty, who is trying to facilitate and convene GPs to come together. We are now looking at a new practice centre and locations are being discussed. But I think, enough is enough. We need this to come together, and it needs some central leadership. We've already spoken, Mr. Holloway, about the centralisation of money and resources. The one thing central government could do, which actually would make a difference, is to actually say this project needs to go ahead, and then tell the local ICB and GPs that you will get the resources, you will get the help, you will get the support, because actually it's your job and your responsibility to deliver for local constituents and residents is absolutely key. Another major population centre, as we are proudly a growing constituency, where there are challenges in health provision, is Tiptree. It's a very famous village, although the village status sometimes is questioned because it is just growing and growing and growing. And the village is famous for its legendary jam-making business, which has royal warrant as well, I should add. We are very proud of Wilkin and Sons. The medical practice there has 12,000 patients registered, which just has 2 GPs practicing there. So while the practice has obviously a range of healthcare professionals working there, the level of GP provision is just too low. So again, coming back to the point that my honourable friend for Clacton has made, if we are to stop the pressures on A&E, which from my perspective, my constituency, pressures on the Colchester side, Colchester Hospital, which is where Tiptree faces, and then on the Whittam side, it would be Broomfield Hospital towards Chelmsford. We absolutely have to ensure that our local practices are supported. We increase our GP ratios, which speaks to my right honourable friend, the member for Chelmsford's point as well, about the need to bolster the medical school and ensure that those graduates come to our GPs. It's absolutely important. And that's why, in Essex, we absolutely believe there is a great opportunity to increase GP provision. The medical school is absolutely outstanding. We want that link to be made. And we just need more GPs to come through from Anglia Ruskin. And quite frankly, if I'm going to say so, I'm going to put a shameless plug in. Come to Whittam, come to Tiptree, and use it as a network through a new hub in Whittam Town to then go further. I do want to, and I know there have been interventions on dentistry, but I do specifically just want to reiterate the BDA's statistics. Around 93% of dentists in east of England are not accepting any new NHS adult patients. And the proportion for children, Mr. Hollowbone, is 81%. I think we should just pause and reflect on those statistics, if I may say so. I find this really quite astonishing. I really do, because of the implications for health and well-being. Poor dental hygiene, tooth decay in children. I mean, that is simply unacceptable. It is just so unacceptable, it really is. And I know and am aware that the government has announced a package of measures to improve dental health and access to NHS dentists in November. But I do think this is just an issue that seems to be deteriorating for lots and lots of reasons. I know the government is doing much more on prevention, but I think, we need to see, as we have seen in Suffolk and North East Essex with the ICB, they provided funds for children aged between 2 and 8 to experience supervised brushing in early years and in school settings. I'm a big believer in our schools, actually. I think our schools can do so much in terms of the health and well-being of children. I think initiatives like that, I said we're all for innovation and pilots, I think initiatives like that should be supported across other schools to improve health and well-being, but dental care, and to show children what can be done and how to look after themselves. Because, if we can't get it right in the early years, and quite frankly, we end up picking up the pieces later on in life with it's not just about costs, but wider health implications. And there is just so much preventative work we can do at the outset. I would also, Mr. Hollybone, like to take this opportunity to comment on our ambulance services across the East of England. And I'm sure for all right honourable and honourable members sitting here today, including yourself, Mr. Hollybone, with Kettering Hospital as well, we are all too familiar with the challenges of our ambulance services. 10 years ago, in fact, in 2013, and I remember this too well, I'm sorry to say, the East of England ambulance service was in crisis. There was a lack of investment in ambulances and paramedics, devastating concerns actually over patient care. There was appalling mismanagement of the board. And I have to say this, I do want to pay tribute to colleagues across East of England back then, because we came together, we spoke with one voice, we basically campaigned to the extent that we changed and forced the board of directors to resign, and we brought in new management. Such was the scale of what was going on. It was just absolutely appalling. And the trust was turned around, and I do want to pay tribute in particular to my noble friend El Howe, who was health minister at the time. He was not only supportive, he would come and sit in on meetings, he would come to the constituencies, he would sit with the ambulance trust, and to the successive chief executives at the trust who've improved plans and increased investments, both in ambulances and in paramedics. It's been a slog. It really has. But we cannot overlook the hard work that has taken place over the last decade. And I do want to pay tribute to all of those who have given up their time, but within public service in particular, who gave up time with the trust to turn things around. In January, I met with the Trust's current Chief Executive, Tom Abel, and visited, in fact, my right honourable friend, the member for Chelmsford, will know, the call handling centre in Broomfield. And they're changing things, they're absolutely changing things. The teams there, the call handlers, were first class. I do want to pay tribute to them. They're dynamic, they're so engaged, but also the way in which they're smart and they're agile, and they're triaging calls, which is making a tremendous difference. And we want to support that. We want to support the right kind of patient outcomes. They care about patient outcomes, they really do. But I think we have to recognise that our paramedics and our ambulances continue to face delays, and that is preventing them from being out in the communities and preventing them from reaching medical emergencies and injuries. And we still have complaints. But I would welcome the Minister's thoughts and insights on this around the East of England, and also where further actions can be undertaken to improve the services. I've mentioned Broomfield Hospital in Chelmsford and Colchester Hospital for emergency care treatments. I think importantly, those hospitals also, they're part of this. They're part of the infrastructure. They need to be reassured that actually the golden thread of integration reaches to them, so that we don't see the appalling days of stacking that we saw many years ago. And importantly, patients do not face unnecessary delays. And with that, of course, we need to see reassurance and commitments from the government to invest and support in hospitals, particularly in acute care settings in Essex and the East of England. And I know other colleagues will want to touch on this. Ageing population, they have more complex needs. And with that, our hospitals have to be equipped to support them. Just as our ambulance service has been on a journey of improvement, the two hospitals have been on quite a journey, if I may say so, on improvement. Broomfield was burdened with the most ridiculous PFI costs when I became the Member of Parliament for Witham. And I'm afraid those PFI costs were absolutely eye-watering, and they were subject to the previous Labour government, and the most horrendous debt had been put on the hospital at the time. Colchester General Hospital has had one of the most interesting journeys, if I may say so. It spent a long periods in special measures, requiring improvements, and now, of course, it's now become integrated into the East Suffolk and North Essex NHS Foundation Trust. Many of the old issues have been resolved, and I think there's been tremendous leadership there as well. Notwithstanding the pressures they faced during the COVID pandemic, I do want to pay tribute to everyone that's working at the hospitals, that have been involved in the turnaround plans. But, you know, again, we have had periods, pre-pandemic, post-pandemic, where waiting times are high. Before the pandemic, Colchester Hospital had a £44 million plan to include the rebuilding of the day surgery unit and investment in a new orthopaedic centre. And, you know, these are important developments, and we want to see these coming together. So I look forward to hearing from the Minister. She's actually welcome to come up to the constituency and to the region any time, I should say, because she can see the panoply of issues that we have, but also the way in which services need to be invested in, are making improvements, but at the same time, we now need to get that golden thread, the integrated care, totally integrated. I would like to, Mr. Hollingbourne, speak about not just GP surgeries and hospitals, but our pharmacies. Our pharmacies play a vital role in providing health services to our residents. And pharmacies are located in the heart of the communities. I have many brilliant pharmacies, and there are fantastic pharmacists around the country. I personally think they are unsung heroes in our communities. They really are. We should just recognise, I think, that they are desperate to play a stronger role in primary care. They really are. They want to help people get treatments. They want to help people when it comes to prescribing. And I was really concerned when I met recently with a community pharmacist in the wonderful village of Tollsbury. And, you know, I would urge the Minister as well to speak to community pharmacists, where I was informed that over the last 7 years, the funding that they have received has been squeezed by 30%. I have been in touch with the department about this. But importantly, they have said very specifically, without urgent intervention, we are now going to see pharmacies close. And that is because we are seeing pressures around the actual funding associated with prescription drugs, the NHS tariff, where pharmacies are to a certain extent subsidising the prescriptions that they are then issuing within the community. And the concerns are such now that we're moving towards a large number of permanent pharmacy closures, putting the safe supply of prescription medicines at risk. And also, I have heard that there are opportunities for the government to empower pharmacies to do more by providing a blueprint for the future of community pharmacy, but it has to be backed by investment. And as of yet, we're not seeing that. We're seeing a continued squeeze. And I think, actually, if I may say so, Mr. Hollingbourne, this is a no-brainer. This is an absolute no-brainer. If you live in a village, if you know, any constituency or any community that is serviced by a community pharmacy, these are places of reassurance. You know, if you are feeling unwell, if you want to take advice, rather than putting pressure on local GPs or, worse still, hospitals. So I think, you know, as we've seen with the son of a pharmacist now as our Prime Minister, I think there is a great opportunity for the pharmacy agenda to take greater precedence and priority across the NHS and in our communities. So I would like to press the Minister on that. And while my Essex colleagues are still here, it would be remiss of me not to raise one of the most contentious subjects that we are facing in Essex. It has been raised in this chamber before, but that is the pressures of mental health services in our county.
Yeah, absolutely.
I'm sorry to say this, Mr. Hollingbourne. We have seen families that have been left devastated when loved ones in the care of mental health services have lost their lives and are now being frustrated when they're seeking answers from, quite frankly, the bureaucracy, the bureaucratic side, and the lack of accountability and transparency with the NHS Trust. And in fact, it's my right honourable member, the member for Chelmsford, secured the debate on the 31st of January into the Essex Mental Health Independent Inquiry. And our concerns are not being allayed at all. The inquiry's chair, Dr. Geraldine Strathdy, has raised many, many concerns. I want to pay tribute to her for her diligent work. And actually the boldness through this inquiry for her to speak out and raise concerns about the lack of transparency, people not forthcoming to provide evidence to this inquiry. And I know that both her and the current chief exec of the Essex Partnership University NHS Foundation Trust are encouraging and supporting staff to come forward to participate in this inquiry. Secretary of State, to his credit, has given strong interest in this as well, and he's trying to give us assurances that the inquiry may be put on a statutory footing, and we welcome that. But I think importantly, and I say this as a former Home Secretary that has been involved in setting up public inquiries into some of the most devastating issues, we would prefer evidence and information for the inquiry to come forward as soon as possible. I'm very conscious, and I have said this to many of the families and victims, the minute it goes on a statutory footing, sometimes it becomes harder for people to actually feel that they can come forward, and then disclosure of names, personal details can become subject to some contention as well. But the point here is that for too long, families, I think, have been fobbed off with excuses, a lack of support. And I actually think they've just not been treated with respect and seriousness when they've raised concerns about their loved ones. And many of them are victims that have had the most horrific abuse that they themselves have experienced at the hands of the Trust. And I think we now need this inquiry to deliver the answers that everyone is seeking. I would like the Minister, I think, importantly, to give an update on where we are on this, while at the same time, and I think this is really important because this is subject obviously linked to the inquiry, we are experiencing, Mr. Hollowbone, too much, and I think it's devastating actually, mental health issues across society. And I think there is much more that we can do now with a focus on mental health and well-being in our schools, colleges and universities, and put a particular focus on our young people. I'm deeply concerned when I hear of young people in self-harm. Subject not for this particular debate, but it's been a subject in the House around online safety and the forthcoming online safety legislation and the roles and responsibilities of the type of information that is put out on social media networks and things of that nature. There is more that we can do, and this comes back to prevention, but there is more that we can do in terms of education and awareness. But we have to have the specialist practitioners locally within the community to provide the essential support that is needed. So I would welcome from the Minister, actually, even some insights around education providers and what they're doing in this area. And I think, actually, if I may, Mr. Hollowbone, I think I could take liberty, being a former Home Secretary, to raise the whole issue of policing and mental health. Certainly from my time as Home Secretary and the changes, part of the Beating Crime Plan, actually, that this government and the government that I was involved in set out very clearly, we made it abundantly clear that the police should not be the automatic backstop and default for dealing with mental health cases and patients, and therefore using valuable policing resourcing and hours to sit in hospitals and A&E where mental health facilities were just not accessible. That is changing, thanks to the work of the government and the initiative that myself and the former policing ministers have put in place. But again, that speaks to the ecosystem within mental health and the numerous pressures in particular. And I think, if I may, just on the subject of education providers and schools, one of the concerns that constituents raise with me is how the health services are supporting children with special educational needs and disabilities. The Minister will be aware. Health partners have a role to play in the education and health plans for young people, pupils, students. But the delays are not cumbersome, not just cumbersome. They are deeply stressing. They have a stressful impact for the pupils, for the families, for the parents, and for the households, as well as the deep challenges. And I'm sure everyone that's joined this debate today could speak wax lyrically about the challenges in securing actual services, including speech and language therapies, to help young people and support them with the needs that they have. And if I may say so, I do go on about this point a lot, but I do believe that the money must follow the students. And that is something that I still think we do not see enough of. I've got a terrible, terrible case of a youngster with very, very specific needs, high needs as part of his education, health and care plan. However, the money that has gone to the school is just not following him in the way in which it should do for outcomes. So, you know, we all know about delays in securing assessments for autism. This is simply not good enough. We know it's been exacerbated by the pandemic. We must do more in this area to absolutely address this issue. I just want to come to a near conclusion by touching on just a few other areas. One is actually Essex County Council. I've already mentioned them already. They actually, all credit to them, I think, have a strong record in investing in health, social care and well-being. And I know they would welcome details of their public health grant. I know it's a sort of calendar time of year where funding allocations come up. They're also involved in piloting Active Essex, where they're exploring how more can be done through prevention and the enablement in health and the social care systems to improve independence and health through increased levels of physical activity. Just on health and social care, I do want to pay tribute to the County Council and also to County Councillor John Spence, who is a remarkable individual, but also the way in which he is really championing this area. And I think, if I may say so, central government should spend some time with us in Essex to look at the innovative ways in which we are working and the way in which we're driving outcomes. They've also transformed day services. They've established a Meaningful Lives Matter programs and are working with local employers to support adults with learning disabilities and autism. And as a former employment minister, the more we can do to support people to get them into meaningful work and employment has great outcomes when it comes to health and well-being. And of course, that is what we want more of. They have a care technology service that was launched in 2021 that is supporting approximately 5,200 people, making the use of technology. We all believe in this, of course we do, but technology to improve health outcomes and independence, which is absolutely crucial. People don't want to be centralised and institutionalised. They want to be enabled to access services, live their lives, and, you know, we're seeing good outcomes, I think, to help people experiencing memory loss as well. They're working with the 3 integrated care systems that cover the county and the hospitals around hospital discharge, and this is important, obviously, from the social care perspective. And the Essex Wellbeing Service has evolved and is using resources both, I should emphasise this, in the statutory and community services area to support health and wellbeing outcomes. I would invite the Minister to come and meet our colleagues in Essex, not just John Spence, but actually our leader of the county, County Councillor Kevin Bentley, because I think we are at the cusp of a good degree of innovation. And I'm also very keen to support, you know, new schemes that can help physical health and mental health and well-being. And so, for example, I've touched on social prescribing, but I'm also about to launch a new initiative, again with schools, called Get Whittam Growing, where, amongst other things, I'll be getting schools involved in terms of growing seeds from the National Plant Collection of Cosmos, and we'll be supplementing these seeds as well with food seeds too, because I just think that, again, you know, we can get much more holistic outcomes, as well as the education benefits, the health and well-being benefits that, quite frankly, we can plant now for future generations. I'd encourage other members to pick this up as well. My honourable friend has mentioned IVF support, but also HRT treatments now are subject to some topicality in the news. And I think it's important to actually raise this point because constituents have expressed concerns. I know that I think across the whole country, people would like reassurance from the Minister about this issue. In Whittam Town, I've already spoken about the health hub, but phlebotomy services have been something that we have raised consistently now for over a decade. Access to blood tests is absolutely crucial. We want to see much more support in that area, both locally, but I think across the region as well. One final point, which I think is quite topical. I raise this because my constituency is growing, and in fact Essex is growing, and it's not just from planting seeds, our population just continues to grow. We have a lot of house building. And I think across Chelmsford and Clacton and Witham, we've seen the developments. They're not small developments. My right honourable friend for Chelmsford has Bewley Park. That's a massive development in various phases. I have Tollgate, which consists of thousands of new homes. Phased development. In Witham Town, we have phased development, which used to be the old Witham Lodge development. There is something that is missing when it comes to planning, and that is the whole issue. When we speak about pressures placed on local health services, we are not seeing the developer contributions stack up to actually meet the needs of the growing local population when it comes to the monies that go into, whether it's through SIL or 106, to work with local councils to actually get the long-term sustainable investments. We see currently developers offer cash amounts based on a formula on the number of new dwellings being constructed. And with that, it's impossible to refuse applications on these grounds. That's a planning point. But we do need to make sure that cash amounts that are made available to councils and to the NHS for new facilities actually materialise. Because currently, again, the money is not following people and outcomes. So I would just like to press that point. Yes, I will give way.
On that point, she's absolutely right that the money that comes for infrastructure from developments needs to go to every sort of infrastructure that those households are needing. And I was really deeply shocked that the money that has been is being allocated by Chelmsford City Council over the past 4 years under Lib Dem leadership, not a single penny has gone towards the NHS. And indeed, the two projects that had been approved by the previous Conservative leadership, that's the Bewley Park Medical Centre and Sutherland Lodge, neither of those have moved forward under Lib Dem leadership. So should she agree with me that that's absolutely shocking and yet another reason why we need to take back control to Conservative leadership of Chelmsford City Council this May?
I absolutely agree with my right honourable friend. And if I remember rightly, both of us have been involved in meetings with one particular health provider, which I'm not going to name, I think were totally inadequate, around Sutherland Lodge, and equally another practice in my own constituency as well. I just think this is untenable and totally unsustainable. And I would really welcome, I've pressed this point many times, but I think the Department of Health and the Minister must work with ministers in Duluth to ensure how best to secure these health contributions. It is a bone of contention. Our constituents are angry about this. Members of Parliament are incredibly angry about this as well. And I'm going to say this, I do find the whole approach, it used to be MHCRG, but, in my constituency has been subject to proposals for a garden community where millions of pounds were wasted around that scheme, when actually money from central government, from the old MHCRG, could have gone via new homes to literally giving us that health hub, that health centre in Witham, and bolstering our health services across the constituency and across Essex, if I may say so, because we are growing. I'm going to conclude my remarks, Mr. Hollowbone. I have deliberately referenced many parts of the NHS and the challenges around health and wellbeing in the region. But importantly, I hope through my remarks, I've shown how interconnected many of these issues are. None of them sit in isolation. And I think this speaks to a wider point that was raised in a previous debate. The size of the state just grows and grows, but the lack of integration in our communities and at the grassroots is really now a sticking point. It's very, very challenging. And I welcome, I thank my colleagues for the contributions that they've made. But I think, importantly, for government and for the Minister, there is a real moment now where we can, not just through the integrated care boards, but across local councils as well, start to integrate our statutory service delivery and hopefully drive better outcomes when it comes to health and wellbeing in Witham, across the Witham constituency, across Essex and across the east of England. Thank you.
Priti Patel to wind up.
Thank you, Mr. Hollowbone. I'm going to start with some thank yous, if I may. Firstly to you, Chair, for the way in which the debate has been chaired, but also to all colleagues that have contributed today. So, Member for South Norfolk, Bedford, Strangford, Colchester, Clacton, Enfield North and also Cambridge. I do just want to reflect on the wide-ranging nature of this debate today and including my remarks. I mean, the NHS is enormous, obviously covering a range of issues. And, of course, the East of England is a very, very large part of the country. On reflection, particularly to the Minister and the Minister's comments, and thank you for your comments and your support and encouragement. The premise of this debate was very much the levelling up of the East of England report, which I think the government has to absolutely start addressing some of the fundamental disparities and issues. But with that, I would just like to touch on a few points that the Minister has made and a couple of other colleagues have made as well. First of all, to the Minister, I think it would be incredibly helpful if we could have some direct follow-up with all the other ministers where there is direct responsibility. I did mention, obviously, the Levelling Up report. I think there is more for Deluxe to do, actually, as a department in this space. Producing reports is one thing, but actually we have to drive outcomes. And I come back to this, we want less centralisation, we want more integration. Yes, we have the ICBs, but actually the role for local government and specialist health providers is absolutely essential. The state cannot do everything. And I'm afraid, and no disrespect to Labour colleagues at all, if money were the answer, we would have all the best outcomes right now. There's no doubt about that. We have to have integration. One of the areas that wasn't touched on, and in fact the member for Enfield North has touched on this about the fair funding formula, is that in the East of England, devolution is taking place right now in Norfolk and in Suffolk. Cambridge already has gone through devolution prospectus. So that could change outcomes tremendously when it comes to integration, but also NHS integration and driving the disparities that the report mentions. So I do just want to emphasise, please do go back to that department post this debate. Challenge them, because they need to be on the hook for a lot of this as well. All colleagues in her department have been incredibly helpful, and I do just want to pay tribute to everyone in the NHS as well. There are a couple of other areas, if I may. The Honourable Member for Bedford has touched on something that is very particular. It's quite particular to me. I think we've been in this chamber raising this issue before, which is about the number of practitioners in the NHS. Broomfield Hospital, Mr Hollowbone, in the last month has told me that they are going overseas to recruit doctors and nurses. Now, as a former Home Secretary that actually bolstered the NHS and social care visa, I think we absolutely have to stand firm and stand by this. We really do. As well as growing our own talent. In our medical hospitals, we definitely need that as well. But the NHS is becoming more and more blended, but we have to ensure that the skills are fit for purpose and they're going to meet the demographics of our local communities and our region and the challenges of this Levelling Up Health report as well. I think if I can just finally conclude, every member that has contributed to this debate, the shadow front bench and the Minister as well, recognises the interconnectedness when it comes to driving outcomes. But there is a greater role to play at a local level here. I genuinely believe now, as a participant, as an observer for 12 years as a Member of Parliament for Whittam, the funding comes out from the centre, but the centre has to do much more to follow the money, people and outcomes. And it is driving the outcomes that the ministers in particular and the department and central government must absolutely be obsessed about, because there is too much lack of transparency and accountability for the billions that goes into the NHS. We in the Whittam constituency, in Essex and across the East of England, are simply, Mr Hollowbone, not seeing the outcomes that match the large sums of funding. And that is something that I hope we will see change. And I hope many of us will be back in this chamber and the main chamber as well to keep really pursuing this agenda across government. Thank you.